Hi, I'm Dr. James Machino. What is PMS or premenstrual syndrome? Well, PMS is actually a cluster of variable symptoms that women get about 7 to 14 days prior to menstruation. And usually around the time of menstruation, it can settle down. Now, some women have dysmenorrhea with it, where they actually have very painful menstrual cramps. And the truth is that a lot of the same nutrition and lifestyle and supplementation strategies that help to tone down PMS also work for dysmenorrhea or painful menstrual cramps. So we're going to talk about those. How prevalent is the problem? Well, it's very prevalent. About 1/3 of women who are premenopausal suffer from some symptoms of PMS. And it's especially common in women 25 to 40 years old. And in about 10% of cases, the symptoms are really severe. So the symptoms can manifest in different ways. So you can have sort of emotional type symptoms where you just feel nervous, or there's more anxiety, or there's more irritability, there's mood swings, fatigue, lethargy, even depression can set in, during that period. There can be intestinal symptoms of abdominal bloating, very common, alternating diarrhea, constipation, appetite changes, or cravings for sugar or chocolate, which a lot of women also report. And then the reproductive tissue can be affected. Breast swelling can occur, uterine cramps, as we talked about, and even changes in libido and other physical manifestations. So if a woman's prone to headaches, often those headaches will be worse during the premenstrual period, or back pain, skin lesions like acne, swelling of the fingers and ankles, not uncommon. The most common symptoms actually are bloating, breast pain, ankle swelling, a feeling that you've increased weight, although it's often just water retention, and changes to the skin. Some acne lesions often show up, as well as some irritability, aggressiveness, or depression, libido changes, lethargy, food cravings. Those are the ones that are most commonly reported by women. The question then is, what's actually causing this to occur? Well, the most common feature of PMS that's in the background is that there's an elevated estrogen to progesterone ratio. And that imbalance about 5 to 10 days prior to menstruation really seems to be at the root of what's going on here that creates so many disturbances. So how does this imbalance occur? Well, either you're producing too much estrogen, or your body's not detoxifying it fast enough. So if your liver detoxification enzymes have slowed down, you won't detoxify it. In some women, they just don't produce enough progesterone back in the ovary in what's called the corpus luteum. But these seem to be, this impact of the estrogen to progesterone imbalance is really at the root of a lot of the problems, because when that occurs, you see changes in endorphin levels in the brain, which are going to change how you feel and set you up for depression, anxiety, mood swings. That imbalance also creates an elevation sometimes in prolactin, which can produce breast pain and aggravate fibrocystic breast disease. That imbalance also alters or increases the secretion of aldosterone, which actually holds water and sodium in the body, and a lot of the bloating and swelling symptoms come from that. So the medical treatment, which is not great, and it's not the first thing you should do, I can tell you, is to, prescribe oral contraceptives, which just basically override your own natural hormonal secretions, which, I think is a real cop-out way of doing it, frankly. The idea is to try to bring these things back into balance naturally. Sometimes doctors will write a prescription for hormones that will also just sort of block the whole ovulatory cycle. Not the best idea if you can avoid it. Sometimes women are given antidepressant drugs or anti-anxiety drugs or diuretic drugs to wash out the fluid and sodium. Or they're given painkillers or muscle relaxants to decrease the breast pain or the muscle cramps from during dysmenorrhea. So I'm not against it, I'm just saying it doesn't really address the root of the problem. What has been shown to be extremely helpful is the right nutrition, lifestyle, and supplementation game plan. Clinical studies have shown that this actually can balance those hormones back out, and many women get tremendous relief from PMS symptoms and dysmenorrhea when they apply it properly. So you understand exactly how to do this, I've created an ebook called The Natural Management of PMS. It's available right here. You should download it right now. It'll explain exactly how you put together a comprehensive program that's very simple, that will, in all likelihood, will make a dramatic difference for you if you subscribe to it and apply it the way I show you. Now, machinohealth.com, you'll also see my other research review papers. You'll see other videos I've created, footage from my live professional seminars if you're more of an academic, other resources and downloads that I've put together that will help you lead a long, healthy, functional life. All my review papers and my teaching materials have all the scientific references in them, so you'll know you're getting only good, sound scientific evidence on any subject you might be searching in the health and wellness arena. So make sure that you use machinohealth.com as an ongoing, reliable resource for health and wellness information for both you and your family. Thanks so much for watching.